If you are searching for the best Medicare supplement companies in New Jersey and you're curious about their monthly premiums, future rate increases, and customer service, today I'm going to shed light on what I believe are some of the top carriers in the state. Hi, my name is Mark Prip. I've been helping people understand and compare Medicare plans for over 15 years. Let's take a look at some of the topics I'm going to cover in today's video. I'm going to look at top companies, monthly premiums, top plans, comparing Plan G versus Plan N. And lastly, rate increase history. The very first thing that I'm going to mention in the beginning is that all Medigap plans are the same. So if you're looking at Plan G or Plan N, it doesn't matter what company you pick. The Medigap benefits are standardized across all letters of Medigap plans. So for an example, Plan G with United Healthcare, the benefits it will cover alongside original Medicare will be the exact same benefits that, let's say, Highmark Blue Cross Blue Shield will cover for their Plan G as well. It's also important to note that all companies have entry-level rates, and rates will increase over time. It is unavoidable. I will dig into rate increase history and give you more insight of what to expect in looking at historical trends. Number one on my list is going to be United Healthcare. Let's take a look. The reason why I said number one is because of their sheer market size. United Healthcare is probably the biggest provider of Medicare supplement plans out of any other carrier in the United States. Their U.S. market share is roughly 32%. I pulled together some sample rates here. I'm using a 65-year-old male in the state of New Jersey. You can see Plan G is coming in at $177 per month. Plan N is coming in at $120. Their average rate increase that we have seen internally over the past year has been right around 7 to 10%. Now that's a lot. I agree with you. Moving on with United Healthcare's additional features, they offer the option to include a Renew Active Fitness program. This is similar to Silver Sneakers. They do have dental and vision and hearing discounts, competitive rates in most states. They're obviously very reliable and a very established company. They've been around one of the longest in the entire Medicare industry. Coming in at number two on my list is going to be Horizon Blue Cross Blue Shield of New Jersey. Their market share for all products in the state of New Jersey is roughly 40%. I believe that they have a market share in covering around 120,000 people in the state of New Jersey, which makes them a pretty big player compared to others. The United Healthcare data I just shared was a national market share, not necessarily specific to New Jersey itself. The sample rates here you can see Plan G is coming in at $178 per month. Plan N is coming in at $132. Again, no big surprises here on the average rate increase over the past year, roughly 7 to 10%. This information is based again on a 65-year-old male in the state of New Jersey. Some of the additional features that Horizon Blue Cross offers, they have an exclusive savings program and discounts through their Blue 365. You can manage your benefits on the go with the Horizon Blue app. That's not that big of a deal, but it is a feature. They do boast no membership or application fees. Certain companies like Aetna have a $25 application fee. Horizon does not. They also offer a premium discount when using the auto pay, which basically means having your monthly premium automatically deducted from a checking or savings account. And coming in at number three on my list is Aflac. Aflac is fairly new to the Medicare supplement market, but they're gaining a lot of attention because their monthly premiums are coming in lower than that of United Healthcare and Highmark. Let's take a look. You can see their U.S. market share is very small. Again, I mentioned in the beginning that they've just started in the Medicare supplement space within just the last couple of years. Example rates here again are for a 65-year-old male in New Jersey. Plan G is $164, Plan N $123. So I put them at number three on my list because Aflac has been around for a long time in the supplemental business for disability, hospital, accident, they have been a big player in the insurance world for a long time. So adding the Medicare Supplement product came very natural to them. And again, their rates are coming in lower than that of most other companies. Again, we're not really seeing any changes on rate increases with Aflac, coming in again around the same 7 to 10% mark. Now, moving on to Aflac's features, they don't have a whole lot to offer. Now, they do offer 4 of the standardized plans, which includes the Medigap Plan G and Plan N, which are the 2 most popular Medigap plans on the market today. They do offer household premium discounts, and they do boast 24-hour customer service. Again, that's not really a huge feature, but I thought it was worth noting. And last but not least, coming in at number 4 is Cigna. We've offered Cigna here in my office for, I believe, 7 years now. Cigna has been very steady and consistent in the Medicare Supplement space. I know that they've had some changes and some challenges in the Medicare Advantage side, but that's completely separate from the Medicare Supplement side. So let's take a look at what Cigna is offering here. They have a little bit higher market share than let's say Aflac, just because they've been in the Medicare Supplement space much longer. So their national market share is around 8.5%. You can see these again are sample rates for New Jersey, 65-year-old male. Plan G coming in at 170, Plan N coming in at 115. Again, no surprise on the average rate increase, coming in around the same 7 to 10% over the last year that we have seen. They have a really strong additional dental and vision plan. Now, these come at an additional premium, but they are very solid, comprehensive plans. They also offer the household discount premium if your spouse applies. They offer the Active and Fit Fitness program, and they also provide a high deductible option, which is going to be high deductible Plan G, which I'll get into a little bit later in the video. One thing I'd like to point out, as I said in the beginning, is that all benefits are the same no matter which company you pick. It's really going to boil down to who's the most competitive on the monthly premium, who offers additional features or benefits like the dental options or the vision or the discount on the monthly premium like Highmark does. That's really going to be the differentiator. When you're looking at, let's say, the popular, Medigap Plan G or Plan N, all the features of those plans will be the same no matter which company you pick. Right now, we're not seeing a big variation between all of the companies. The rate increases seem to be about the same, and those additional ancillary benefits. Now, let's talk about the most popular plan. The 2 most popular plans today are hands down going to be, number 1 is Plan G, has well over 5 million members enrolled nationwide throughout all of the companies combined. Number 2 is going to be Plan N, has roughly 1.4 million members nationwide throughout all of the companies' enrollment. Let me stop right there just a moment. Again, we're talking about the 2 most common plans are Plan G and Plan N. The big difference is going to be, as you saw when I stated the quotes for Plan G and Plan N, Plan N generally has a lower monthly premium. And the reason for that is there's a couple key features that are different between Plan G and Plan N. Plan G has no copays. Essentially, all of your deductibles and copays that original Medicare has, Plan G will pay those for you minus the Part B deductible. So if you have the Plan G, you have to pay the Part B deductible each year. And for this year, 2025, that deductible amount is $257. So again, you pay that Part B deductible. After that, Plan G is going to pay everything that Medicare leaves you with. So if you have a hospital deductible with Medicare, if you have outpatient testing, if you have office visits, anything original Medicare leaves to you as your responsibility, the Plan G will pay for. When you move over to Plan N, the reason why Plan N premiums are slightly less, and this is why, you're going to still have that Part B deductible responsibility with Plan N. So the $257 annual deductible you will still pay with Plan N, but Plan N also has two additional features. They have a $25 copay that you pay each time you have an office visit. And if you use the emergency room or urgent care, you could also pay a $50 copay per visit as well. So Plan N offers a slightly lower premium because you are responsible for a slightly additional amount with those office visit, urgent care, and emergency room copays. So it's important to look at the annual savings of Plan N. Is that enough to justify you having to pay those Part N copays? Sometimes it makes sense to do the Plan N because the savings is so significant, but depending on your age and your location and the company, the premiums might be so close, it's just worth paying the Plan G premium and not having to worry about those small copays and nickel and dime you to death, so to speak. Let me move on to probably the most asked question, and that is rate increases, okay? You saw that I covered those briefly when I went over each company. Historically, we were seeing rate increases on average of around 3 to 4% per year. That is very favorable, very generous. When the COVID pandemic hit, most people that did not have urgent care or emergencies or urgently needed treatment, they postponed getting that care done. So a vast majority of people held off on medical care during COVID and quarantine and delayed getting that testing or surgery or treatment done. When COVID settled down, there was a massive influx of people that returned to the medical doctors and hospitals to now get that delayed care treated. So that basically created an influx or a tidal wave all at one time. And that is why we're seeing rate increases in the 7 to 10% range. The hope is that once this post-COVID claims calms down, these rate increases will also go back down to more favorable amounts. That is the future hope going forward with rate increases with all companies. Here's my advice to you. A lot of people I see on Reddit, there's a lot of activity on Reddit around people turning 65 and getting on to Medicare, and they have decided they do not want a Medicare Advantage plan because of all of its restrictions and changes. They've made up their mind that they want a Medigap plan, which I commend them. And if you're watching this and you have decided not to get a Medicare Advantage plan, I commend you as well. Medigap is far superior than any Medicare Advantage plan could ever be. Peace of mind. There's no prior authorizations. There's no referrals. There's no plan changes. There's no loss of doctors and hospitals. So Medigap is superior. When you're out there looking, be very careful when you're on Reddit because there's a lot of bias about people's experience with different plans or different companies. There's not a whole lot of need to focus on customer service satisfaction with Medigap because generally with Medigap, Medicare is going to again pay their portion and the Medigap plan is going to pay their portion. This basically means that because Medigap does not use networks or prior authorizations like Medicare Advantage, there's very little moving parts for you to have a need to call customer service. You're generally calling customer service to try to change your plan maybe, or to question a monthly premium billing change. You're generally not going to have a lot of claim problems with Medigap. So there's not very many instances where you would need to call the carrier direct. Unless you're going to cancel the plan, change your automatic payment option or change your address, something basic like that. So I advise you don't get hung up on trying to read online about customer service experience because you may not find a whole lot there in the Medigap side. Again, when you're comparing plans, it's important to prioritize the actual plan benefits. You are protected with guaranteed issue rights if a Medicare supplement company should become insolvent insolvent or go out of business. So if you're afraid to pick Aflac because of their small market share, I would encourage you to not be concerned about that. Let's say a worst case scenario, Aflac goes out of the Medicare Supplement business. You have a guaranteed issue right now with that company going insolvent that you would just pick another company and enroll without any health questions. So that protection is there for you. If a company goes insolvent or has problems, you're not just left high and dry. You have guaranteed rights to move to another company. All of the chatter online can cause basically what I have heard the term is called paralysis by analysis. Don't overthink this. If you've made the choice to pick a Medicare supplement plan and you've closed the door on the idea of a Medicare Advantage, you are already way ahead of the game and you are doing the best possible thing for you and your healthcare and your finances by picking a Medicare supplement plan. If you have questions on anything I've discussed, you can comment below. If you'd like us to run a needs analysis, that basically means you call us, you tell us your situation. We will do some fact finding, ask you some questions to try to determine which company or which plan may be the most suitable, and then we present you with the ideas. So again, thanks for watching. Comment below. Call us if we can help in any way.